Many times we have patients who come to us and say, "Oh doctor, we have this mid-face which looks sunken. So what are the treatment options we have?" Hi, I am Dr. Arun Panda. I am a facial plastic and hair restoration surgeon and I practice in Mumbai. So as I was mentioning, a lot of patients, especially in the mid-age of say 40s, they come to us and they ask, what are the treatment options to do this mid-face rejuvenation? We've heard of a lot of surgeons and practitioners who do rejuvenation for the upper face and the lower face, but I would say the mid-face is also very important. So what are the treatment options when we get patients who complain of sunken cheekbones and this mid-face area? So a lot of people do fillers. So fillers are hyaluronic acid materials which can be injected beneath the skin and they stay there. So the problem with fillers is they last for anything between 8 to 12 months and then they dissolve. Plus the amount of filler to rejuvenate and fill up these areas, the quantity is very high. The second option is to do fats, but I personally don't like fats because fat, if I put it, I don't know after 2 years where the fat is going to be. So what is the best option we have? We have something called as cheek implants. So the malar implants are made up of silicone. There are other materials too, but I prefer to use silicone implants from the best companies, the Silicone. So these implants are shaped like your cheeks and they are placed underneath the skin. So what happens is we make small incisions from inside your mouth and we place these implants right onto the bone. So there are three kinds of implants which are made up of silicone, which can stay either in the submalar area here. So we can make a small cut in the implant and we can place it right here. And the other thing is we can have something called as a malar shell which comes on the zygomatic prominence here. Or there could be a combination of these two also. So most commonly patients ask for the malar shell and the submalar implants. So we make small incisions from inside our mouth. We place the implants there which are made up of silicone, and I prefer to use two titanium small screws to kind of keep it intact there so that it doesn't migrate over a period of time. The advantage of using a cheek implant, silicone cheek implants, is that it is permanent, it doesn't dissolve. Second thing is it's retrievable. In case after a few years patients don't like it, we can always take it out. The chances of infections are very low, and when we compare the cost with fillers which you do every year, this works out cheaper. So if you ask me what to do when we have a mid-face which doesn't have volume, I would say the best option is to do cheek implants. So if you have any queries regarding cheek implants, please let us know. We will be more than happy to help you. You can watch our other YouTube videos wherein we have live surgeries where we have showed how to do cheek implants and the results. If you have any queries, please feel free to get in touch with us and we will be more than happy to help you. Thank you. This is Dr. Arun Panda, facial plastic and facial surgeon, signing out. Thank you.